Welcome to The Explainer. Today, we're going to dive into something super important that stands between you and any clinical research study: informed consent. And trust me, it's way more than just a form. It's your ultimate protection as a participant. All right, let's kick things off with this quote because it really hits the nail on the head. Informed consent is so much more than just signing on a dotted line. It's a human process, a real conversation, and it's all designed to make sure that you are firmly in the driver's seat of your own decisions. Exactly. And this is so important to get. It's not some one-and-done thing. You should think of it as a continuous two-way dialogue between you and the research team. This isn't just about bureaucracy. It's a safeguard that was born from a pretty tough history where patient rights weren't always respected. This whole process is here to make sure that never happens again. It gives you the power to ask questions anytime, before, during, or even after a study. And this leads to a really key principle. The investigator's main job isn't to get your signature on a form, not at all. Their job is to be a great teacher. They have to explain the study in simple, easy-to-understand language, not just, rattle off a bunch of technical facts. Their goal is to make sure you genuinely get it before you agree to anything. Okay, so keeping that idea of education front and center, let's break down the core principles that really make this whole thing work, ethically. So here it is, the official definition. But what it really boils down to are three pillars. First, you get all the information. Second, you truly understand it. And third, your decision to join is made with absolutely zero pressure. It has to be your choice, 100%. I love this slide because it shows the difference so clearly. On the left, you've got basic information sharing. It's a one-way street, pretty much focused on checking a box. But on the right, that's where the magic happens. True education. That's a two-way discussion that's all about making sure you actually understand. Questions aren't just allowed, they're encouraged. So, you might be wondering, who's actually involved in all this? And what does it look like, step by step, in the real world? Let's break down the people and the process. It really boils down to three key roles. First, and most importantly, there's you, the participant. Second, you have the investigator, whose job is to explain everything clearly. And third, and this is a really crucial role in some cases, the impartial witness. This is a totally neutral third party who's there to be your advocate, making sure everything is fair and pressure-free, especially if a participant can't read the forms themselves. Okay, and the process itself follows a really clear path. And you'll see every step is designed to put you in control. It starts with a full explanation, the good, the bad, all of it. Then there's a Q&A where no question is off limits. Seriously, ask anything. Then, and this is critical, you get time to think it over. No rushing. Only if you decide to go for it is the consent documented with signatures, and you always leave with a copy for your own records. Okay, but what about the tricky situations? When life isn't so simple. What happens when a person can't actually give consent for themselves? Well, the system has special safeguards built in for exactly these cases. And that's the big question, right? To be truly ethical, the system has to have rock-solid protections for the most vulnerable people out there. This table does a great job of showing how the rules change to fit the situation. For kids, a parent has to consent, of course. But if the child is old enough to get it, usually around age 7 or so, their own agreement, called assent, is also needed. For someone who is incapacitated, a legally authorized representative steps in, and their job is to make the decision they believe that person would have wanted. And in a real emergency, consent can be waived, but only under the strictest of rules. And I really want to double down on this emergency point. You can't just skip consent. It has to be a life or death situation, and an independent physician, someone who is not involved in the study at all, has to agree that it's absolutely necessary. This makes sure that even when every second counts, there are still powerful ethical checks and balances in place. All right, we've gone through a lot of the details, so let's pull it all together now and focus on the single most important takeaway for you or for anyone you know who might be considering a clinical study. Look, if there's one thing you take away from all this, let it be this. Informed consent is your fundamental right. Plain and simple. It's a process, not just a piece of paper. The entire goal is your understanding, and your participation is always voluntary. You can join and you can leave at any time. This whole framework is there to protect you and your power to choose. So that leaves us with one final big question to think about. In today's world, with medicine getting more and more complex and forms getting longer and longer, how do we make sure this process always stays focused on that simple human need to truly understand before making a choice? It's a challenge that's definitely worth thinking about.